Hi, everyone. Welcome back. Erin Foley here, NADF co-president and your moderator for this Navigating Adrenal Health Conference. Our next speaker today is our very own Vanessa O'Rourke. She's the Community Engagement Manager for NADF, so many of you may have had contact with her before. And she is going to talk about patient and caregiver resources, and then hopefully have some time at the end to take some questions. So with that, let's get Vanessa started.
Thank you for tuning in for the NADF Patient and Caregiver Resources presentation. My name is Vanessa O'Rourke, and I am the Community Engagement Manager for NADF. While I may not know what you're experiencing as a caregiver, family member, or individual, I have gone through my own diagnosis of adrenal insufficiency and know the challenges that can come along with it. NADF's mission is to inform, educate, and support individuals impacted by adrenal disease and enhance their quality of life. This is something that I personally experienced after my own diagnosis of Addison's. It wasn't until I found NADF that I realized I was only prescribed half of the necessary medication I needed to survive. The resources, information, and support I received after reaching out to NADF saved my life, which is why I'm so happy to share with you all the things NADF has to offer. We have an entire page established to help those who are newly diagnosed with adrenal insufficiency. Our first steps for the adrenal insufficiency patient is a great starting point to anyone who has been recently diagnosed. It's a detailed brochure walking you through all the steps to take after receiving your diagnosis. This page also directs you to the NADF introduction video, giving you key highlights on what to expect from our organization. We have information on the patient registry My AI study, which we'll learn more about in our next presentation, but it currently has over 1,000 individuals enrolled. Recruitment has been paused temporarily, so please stay tuned for updates. There are detailed videos and guidelines that you can share with your medical team to make sure the appropriate labs and appointments are scheduled. When you reach out to NADF, response time is typically within a day or two to address all your questions. If you decide to become a member, you'll receive our quarterly newsletter. You do not need to donate in order to receive other benefits, including joining a support group, although donations are, of course, always appreciated. NADF is here to support you, and if you have any questions, please contact us at any time at nadfsupport@nadf.us or 847-726-9010. Emergency handouts are essential when it comes to staying safe. NADF has multiple life-saving documents that you can print out and carry with you in case of an emergency, including Adrenal Crisis Alert Flyer with translations in Spanish, French, Italian, Polish, and Portuguese, which can be great for traveling. Adrenal Crisis Alert Flyer for children, translations available in Spanish, emergency injection instructions, medical alert information, disaster preparedness, digital emergency wallet ID card, and emergency injection instruction card, both available in Spanish, and emergency guidelines for ER personnel. I personally have many of these documents printed, laminated, and keep them with me at all times, just in case. NADF protocols are wonderful resources when trying to establish the appropriate way to update or navigate a surgery. We offer stress dosing guidelines for adults and children, which we also have translations in Spanish. The surgery protocol for adults can help you prepare and inform your surgical team of all the needs you will have while in their care. We also have a list of the adrenal hormone replacement protocol to ensure your medical team is appropriately checking and replacing all potentially missing hormones due to adrenal disease. NADF has facts you need to know pamphlets with detailed information on each of the following adrenal diseases: primary adrenal insufficiency, secondary adrenal insufficiency, Cushing's syndrome, congenital adrenal hyperplasia, pediatric adrenal insufficiency, primary aldosteronism, adrenoleukodystrophy, and pheochromocytoma. Individuals are always reaching out to ask if NADF knows of an endocrinologist or medical professional in their area. We're glad to be able to offer our patient-recommended doctor map. Every doctor on this map came as a recommendation from an NADF member. Contact us to have your favorite doctor added as well. This will help others more easily find a doctor who understands adrenal disease. This list is compiled from recommendations by fellow adrenal disease patients and does not represent an endorsement on behalf of the National Adrenal Diseases Foundation. To use it, zoom in on your desired location and click on any relevant marker to access the doctor's current contact information, or click View Larger Map in the upper right corner to open it in a new window where you can access the search bar. NADF has a wide range of support groups across the United States. Many of these groups are held virtually, so you can truly join in from anywhere. We currently have groups in Colorado, Delaware, Florida, Hawaii, Kentucky, Maine, Massachusetts, New Jersey, New York, Pennsylvania, Ohio, Texas, Utah, Virginia, West Virginia, Washington, and Wyoming. We also have specialty support groups: a caregiver and family support group, our Courageous Cushing's support group, teen support group, and NADF support group for all. We also have a virtual platform, NADF Inspire, where you can use this to connect with individuals across the country in real time. NADF is on the following social media platforms where you can follow along, share, and like to help raise awareness and help others find important life-saving information. You can find us on Instagram, Facebook, X, Threads, TikTok, Blue Sky, YouTube, and Inspire. The NADF calendar lists all the upcoming support group meetings, conferences, and any events that are on the schedule. This is constantly updated as new things are being added to our schedule, so be sure to check it frequently. Some upcoming events are our support group meetings, our Colorado support group meeting, Delaware support group meeting, and Cushing support group meeting. All Things Adrenal is a monthly podcast dedicated to education, awareness, and stories from individuals living with adrenal disease. Hosted by me, Vanessa O'Rourke, featuring interviews with patients, doctors, caregivers, and others impacted by adrenal disease. We have 7 episodes available at this time that you can listen to and share with others. Our introduction, my personal adrenal insufficiency story, and interviews with Dr. Smita Abraham, an endocrinologist, Hilary Hodge, an author and advocate, Jenna Cora, caregiver for a child with CAH, Wendy Moses, Cushing's and adrenal insufficient patient, and Dr. Lindenberg sharing about an ongoing aldosteronism study. You can find All Things Adrenal on any platform that you use to listen to podcasts, or visit nadf.us to learn more. NADF News is published 4 times a year. In every issue, there's a Q&A section written by Dr. Paul Margulies, Medical Director of NADF. We include all these Q&As and more on our website for you to explore, search, and read through. To find a particular topic, go to any page and you can do a search. Here's an example of one of our members' questions. Is it safe for those with adrenal insufficiency to get multiple vaccines in one day? For example, flu, COVID, and/or RSV? Should there be a few days spaced out between them? I do recommend all three of the current virus immunizations, the influenza, RSV, and new COVID vaccine for individuals with adrenal insufficiency. In my opinion, it is prudent to take no more than 2 at a time. All these can be found in our Q&A section. We encourage you to visit our news page, where we post updates on research, new medications or shortages, upcoming events, and more. This is a great resource to staying on top of and aware of all things happening for our community. Our links and resources page has a wide range of organizations, nonprofits, and foundations that can offer additional help to all patients and caregivers. These organizations can assist navigating insurance, financial support, and even resources in other countries. Be sure to check it out. We have an entire page dedicated to medical publications, which includes official Endocrine Society guidelines addressing specific adrenal diseases and articles from the Journal of Clinical Endocrinology and Metabolism. We have a page dedicated to EMS and physician resources. For physicians, we have information on sick day or stress dosing guidelines for adults and children, emergency prescription guidelines, and diagnostic tests for adrenal insufficiency. For EMS, we're pleased to share Recognizing and Managing Adrenal Crises in the Field with NADF, a free webinar from Prodigy EMS and NADF. This webinar can be watched through the remainder of the year. NADF has a range of educational and awareness videos from various adrenal disease experts and members that you can find on our website. You can also find more videos on our YouTube channel, NADF_adrenal. There are many ways you can support NADF, and we're deeply grateful for your generosity. Your gifts make it possible for us to advance our mission to promote education, provide support, and sponsor research that improves the lives of those affected by adrenal disease. While membership is only $25 per year, we encourage and greatly appreciate additional donations that allow us to expand our impact. If membership is not financially feasible, please just contact us. We're happy to accommodate anyone who cannot afford it. We also run special drives where you can donate directly to a specific cause. For example, Adrenal Crisis Education Drive directs your contribution towards educational materials, resources, and events, such as this conference. You can donate to research. This allows your donation to help change the future of adrenal disease treatment. Tributes allow loved ones to create a tribute page in honor of their friends or family who lost their life due to adrenal disease. We also have NADF t-shirts. A shirt can be a great way to show support and help raise awareness at the same time. Thank you for taking the time and energy to learn about many of the resources NADF has to offer patients and caregivers. Please feel free to contact NADF or myself at any time by email at nadfsupport@nadf.us or by phone at 847-726-9010. Thank you.
That was great, Vanessa. Thank you so much for taking the time to put that together for all of us. We really only have one question so far, so please, everyone, feel free to jump in that Q&A because we do have a few minutes. Could you offer a director of US endocrinologists that specialize in adrenal disorders? That would be very helpful. Do you want to take that or do you want me to take that?
Sure, I'm happy to. As I mentioned in the previous slide about, we do have the doctor map, which is an absolutely fantastic resource. It has all medical professionals, not just endocrinologists. It also has mental health experts, depending on the area and where our members suggested or offered their recommendation. While it may not have a specific section to search adrenal disease or adrenal insufficiency experts, um, it will pop up anyone that we have in our directory in our system. Um, Erin, do you want to add on to that?
I was just saying, just thinking, what we've done in the past is we've relied on recommendations because just because an endocrinologist has a subspecialty in adrenal disorders does not mean they're going to be have a great bedside manner or be willing to work really, really closely with those of us who have adrenal disease, which is so important. But it's definitely something to think about, potentially cross-referencing the two lists if we can find one. So we will thank you for the suggestion. We'll look into that for sure.
And I do want to piggyback off that really quick and just say we also, we're asking members to recommend, but if you also go to one of the doctors that we recommend and have a different experience, please keep us posted so that way we can update and keep our lists up to date.
Yeah, and just as a reminder for folks, take a minute to see if you like your doctor, your endocrinologist. Take a moment, if you would, to see if they're on the map already. And if they're not, let us know. I mean, this is, as you know, likely, anybody on here with adrenal disease, it can take years to find someone you trust, who works with you well, who understands you, and is local enough that if you land in the emergency room, they're going to be available to take the call and potentially run over to the hospital if that's necessary. So we appreciate all your referrals. Okay, so we have another question. How can we start a support group in our state?
Great question. You'll reach out to me at the email below, nadfsupport@nadf.us, and let me know where you are. We can set up a phone call, and basically we'll have a very informal, casual conversation to kind of chat a bit about what that would entail. We have a training we walk you through, and we're here to help every step of the way. Our support groups, we would love to have as many as possible in every state, and it is as much for the leader as it is for the attendees. So please do reach out to myself, or you can call and leave a voicemail. But email's the best way for us to be able to connect and schedule a call to get that going. Thank you for asking.
Yeah, and so a related question, but a little different. Uh, Someone's asking if there's not a support group in their state, could they join another state's support group? And can you talk about the other options that I know we offer?
Absolutely. So, of course, you can join in. The great thing about many of our groups is that they meet virtually, so you can truly join in from anywhere. On our calendar page, it has a list of all the upcoming meetings and groups that have a scheduled event, and all you have to do is email that leader to request to join. If you don't have one in your area, totally fine. You're welcome to join any group. Obviously, there are some benefits to having a group within your area and connecting with those, because you can chat about local medical professionals or chat about extenuating circumstances like weather and things that may impact you and your condition. But we do also have a virtual support group for all that meets on the third Thursday of every month at 8 p.m. Eastern Standard Time. You can register for that group on our support group page, or you can reach out to me and I'm happy to connect you. And that is a solely a virtual support group. You can join in from anywhere. A lot of our groups only meet virtually, but some meet virtually and in person. And if you are unsure, you're always welcome to reach out.
Thanks. Yeah, so it's, the world's evolved a lot since COVID. and when I started with NADF, as a member over 30 years ago, it was done by state because you had to go somewhere.
Yeah.
And for me at that time, so first of all, I was away at college in Pennsylvania, and I don't know that there was a support group within, 4-hour drive. And when I was home in New Jersey, the New Jersey support group was almost 90 minutes away from me. So this virtual thing, I think, has been just a blessing in disguise for, folks who are really far away. So I welcome all of you, encourage you all to join a group, see if it's for you. Groups interact differently, they operate differently. So if you have tried one and you didn't feel comfortable there, or you're looking for a different vibe in your support group, try another one. These having other people to talk to who know what you're going through and who might have little tricks, right? Like we learn these things along the way. And for those of us who have had to learn the hard way, I'm always glad to offer my experiences to someone, who's newly diagnosed, not medical advice, but, from my patient perspective, I didn't know this until I had Addison's for 15 years. How is that possible? So, we also want to just mention that all of the resources that Vanessa just walked through that live on our website are going to be more easily accessible soon. We are working on a new, cleaner, more user-friendly website that should be more intuitive. All of those things are there. If you're looking for something and you can't find it, please email Vanessa at the email on the screen. And, we are working on that. We know it's been a little bit of an issue for some folks to navigate. So we're working on that. Anything else you want to add, Vanessa, before we close out?
I just want to say, please don't hesitate to reach out with any questions at any point. If you're a caregiver or a patient, I know the journey as a patient I can share is very lonely and very scary in the beginning, and you do not have to do this alone. We're here to help you. That's literally what I'm here for at NADF. Call me, email me. I'm here to support you and give you any resources and connect you with others in your area, or just connect you with others so that you don't have to do this alone.
Awesome. Thank you so much, Vanessa. And I
Thank
just
you.
want to give Vanessa a shout out because she's been an absolute gem since she joined NADF a few years ago. And we really appreciate all you do for our organization.
Thank you, Erin.
All right, guys, we have our final speaker coming up next. It's a good one, so I'll see you there.